Thank you, Professor Kim, for a nice introduction. And it is my great honor to have a presentation here. And actually, in my beginning period of the studying of radiation protection, the ICRP publication is a good teacher for me. And just I learned a lot about the history of radiation protection and history of the ICRP. And thank you for Dr. Pace. And yeah, I will start to my presentation here. I divided my lectures in 4 parts, and first, I will introduce the background knowledge for our national healthcare system, and second, for our unique Korean regulation for medical exposure, and third, current status of radiation exposure in Korea, and going to second part, I will introduce to how to perform the principles and standards of radiation protection in Korea. And third part, I will introduce the effort of radiation exposure control for each stakeholder, including radiologists, medical physicists, and radiographers and manufacturers. And then next, I will introduce the summary. And let's move to first topic. In Korea, we have a very unique healthcare system, and I will shortly introduce the overview of the healthcare system in Korea. We have national-owned national health insurance system with the government operated, and this single largest health insurance system covered all the private hospital and public hospital in Korea, and the providers and residents must register mandatory to this NIH system and under the regulation by the government. And most of the reimbursement covered by the NIH, but we have a portion of private health care, especially for private individual health assessment, I mean that healthcare screening. And we have 2 regulation body of medical exposure control. One is for the diagnostic radiation control. It is regulated by the Medical Service Act by the Ministry of Health and Welfare. And the second portion, radiotherapy and nuclear medicine, is controlled by the Nuclear Safety Act and the relevant of the Nuclear Safety and Secure Commission. But these are all about the equipment safety. The current regulation is not focused on patient safety much. This is the situation of our medical equipment. For 2010, we have CT scan for 1,700 equipment and MRIs for about 1,000 equipment. And this is the trend of radiology equipment in Korea, and it is gradually increased, but these days it is somewhat stagnated. This is the OECD healthcare statistics, and MRI units and CT scanners, the number of the Korea's MRI and CT units are very high in rank of the OECD countries, in 6th and 5th rank in OECD data. For number of examinations of the MRI and CT scan, it is somewhat lower ranked. I think it is because the exam does not include the private funded examination, because we have many health screening system without covered by the national insurance. So that's why the number of the MRI examinations and CT examinations is somewhat lower than the number of the equipments maybe. But we also have an increasing tendency for annual number of diagnostic radiological examination in Korea. This is the statistics from the KCDC. Comparing the 2006 to 2011, the total radiological imaging examination is increasing average of 8% per year, and for the CT scan, it is increased average 14% per year. For the effective dose, the annual per capita effective dose in Korea is increasing also very rapidly, and In 2011, we have 1.4 millisievert per year effective dose per caput, but I think that the real dose is somewhat high because I already mentioned these data does not include the not covered health insurance system, so many screening data are not included in this effective dose data. So these days, our national government is very much interested with the radiation protection, and the professional society is actively collaborated with the national agencies. The Korean Society of Radiology and Korean Radiation Technician Association and Korean Society of Medical Physics is a relative professional organization, and we are very active collaborating with the national agencies, including Ministry of Health and Welfare and Ministry of Science, ICD, and Future Planning. And they have other organizations with the DECA, HERA, and NSSC or something. So let's move to the second topic for principles and standards. Yeah, we regarded the radiation exposure control for 3 stages. First one is equipment control, second one is imaging quality control, and third one is clinical practical guideline, I mean the justification. So each control, we have a regulation system or other effort for making a guideline something. In Korea, medical exposure control is regulated by laws, but this kind of 3 laws are regulated by regulation. Regulation for audit of medical diagnostic equipment such as X-ray, CT, and mammography is included on-site audit and installation time and regular 3-year checkup. This is governed by Korean CDC. And second act is regulation for audit of image quality of diagnostic equipment such as CT, MRI, and mammography. This includes paper and on-site audit by Medical Act, and they are planning to expand the equipment to other equipments, but not yet. And third one is quality control for a National Cancer Screening Institute, and it includes the quality control of the screening equipment, including X-ray and mammography and fluoroscopy. The justification of medical exposure is very important portion of the radiation protection, and 3A, maybe already all of you know, the awareness and appropriateness and audit is very important portion of the justification. For the awareness, knowledge and effective communication both with patient and healthcare professional is very important, and after the full communication, the informed consent is very important for communication. And we need to provide education training for physicians other than radiologists or nuclear medicine physician. And it is vital to raise awareness about safety among health professionals is very important for us. Second one is appropriateness. For use of the criteria and reporting guidelines is very important, but we are not yet established wholly. But Korean Society of Radiology is now have a strong effort to make guidelines, and I will show later. Third one is clinical audit is very important for a process, and it also includes referral is very important portion of the audit. This is the organization of Korean Society of Radiology, and we have many subcommittees about the advocacy or the radiation protection. So these are about the radiation protection area, and we have health policy and practice committee, and I will serve the radiation safety committee. I served, and accreditation and other ranks. Radiology advocacy network is also regarded as a radiation safety section. Additionally, Korean Society of Radiology have many efforts to quality and safety from 2004, And the major things are included the establishment of the Korean Institute for Accreditation of Medical Imaging for the accreditation body of the CT, MRI, and mammograph, like USA's MQSA. And after that, Korean Society of Radiology have many effort to making national DRL. And in 2002, Korea's Committee for Clinical Guideline is developed, being comprehensive clinical imaging guideline with the NECA. And 2015, Korean Society of Radiology started to subcommittee for a radiation advocacy network of quality and safety. So in these subcommittees, they have many activities for a guideline of imaging study with various other organs, including guidelines for use of the cardiac CT, and CT guidelines for repeated imaging, and justification guideline for CT examinations, and optimized guideline for CT examination, and exposure of asymptomatic individual in private screening. These are syllabus of the guideline. I'm sorry, many Korean letters, so you can understand, but we have provided many guidelines to the hospital or other people. And these days, we collaboration with the NECA, we have project with the developing comprehensive clinical imaging guideline by adaptation process, actually a hybrid process. We have 10 working groups and 30 key questions made for our Korean imaging guidelines. Korean Society of Radiology has a strong relation and international collaboration with other parts. And we are attended or we invited many this kind of the international meetings, and especially next year in September, WHO International Workshop on Justification of the Use of CT in Asymptomatic People for Individual Health Assessment is hosted by KSR in Seoul. We are not yet, the venue is not yet decided, but the date is fixed, so you can remember, and if it's possible, you can join to us, and we have many fruitful results expected. I will show the special subcommittee of KSR called the Radiology Advocacy Network of Korea for Quality and Safety. Actually, it is from the volunteer organization started out in 2013. And radiologists voluntarily together and study about the radiation safety or other quality issues. And these days, annual length QS symposium and monthly meeting is held. Our contents are included the radiation safety and contrast media and quality management, and including other things. And we also discussion about the future of radiology and other reports for quality, safety, and policy of radiology as our topic for study. So the justification, the radiologist is a main role, and they are eager to providing education material or guideline to other physicians. And for second thing, optimization of protection and safety is more important for medical physicists and radiographers maybe. And it includes the consideration of equipment and software design and operation, and dosimetry of the patient and diagnostic reference level is very important portion of the optimization. And also, quality assurance program is very important thing about the optimization, including standard operating procedure and equipment quality control and clinical audit. I will again introduce our organ of the Korean Institute for Accreditation of Medical Imaging called KIAMI. And I will introduce the historical background of the quality management in radiology in Korea. In early 2000, we have many the medical fee is very much lower, and the increased rate of self-referral for compensation of the medical fee. So the overutilization of the radiological examination is a very important thing for discussion. And at that time, we had abolition of regulation for restriction medical equipment. So the increased number of second-hand equipment, it resulted in poor quality imaging. So Korean, at that time, we called the Korean Radiological Society, and then realized that the importance of guidelines and standards of quality management. So at that time, we are very much eager to make guidelines or safety standards. So in 2004, Korean Society of Radiology founded the Korean Institute of Accreditation of Medical Imaging, and all CT, MRI, mammography equipment must be quality control test mandated by Medical Service Act Article 38. This is the 10 years failure rate of the equipment quality control system. And at first, the failure rate is very high. Actually, in this time, we didn't do MRI for quality control, but for CT scan and mammography, there is a high failure rate, but after 5 years, the failure rate is very high. So we regarded that the lowering failure rate is the successful of the quality control. The second thing is National Survey of the Radiation Dose in Korea. Korean FDA's National Institute of Food and Safety Evaluation is executing a national survey of the radiation dose in Korea year by year. And Korean database of patient radiation exposure in radiological examination, including CT, fluoroscopy, angiography, and mammography, and general radiography is established. And from this data, diagnostic reference level of our Korean own one is established from the chest PA mammography in 2008, and consecutively CT scanning and pediatric chest radiography and pediatric CT and general radiography and dental imaging consecutively. And maybe next year, they are planning to a revision of the diagnostic reference level of the CT scan. These numbers are DRLs for diagnostic radiological examination in Korea, and we have X-rays and mammography and dental imaging. And for CT scanning for pediatric and adult patients are already exist. Comparing the other organizations or other countries' DRL, our DRL is somewhat lower or the average of the DRL, because that's why DRL is somewhat, the equipment is actually, we have many brand new equipments, but the protocol is not yet completely established, so that's why the DRL is not so low for recent evaluation. And move to third part, I will introduce the role of the stakeholders in Korea and our efforts to radiation exposure control. Last year, I and my colleague performed the research on establishing a patient-focused diagnostic radiological dose control system, and I will introduce the background of this research. The purpose of the research is to form a basis of the Korean legislation for producing a patient-focused radiation management system. And the National Congress and press have constantly been raising issues regarding radiation dose control as part of ensuring radiation safety for patients in Korea. And the Ministry of Health and Welfare is planning to devise a detailed management system due to the 2012 and 2013 national audit result to ensure radiation safety. So the research project purpose is to establish a diagnostic radiology dose control system, which is an optimization portion. And our issues and challenges are as follows. For first thing, for the diagnostic radiation dose measurement, dosimetry will be a fundamental contribution, but in nationwide equipment in Korea, the equipment does not support the dosimetry directly. Only small portion of the equipments that automatically support those information. So the first thing is the dosimetry is very important, the first thing. And for performing monitoring, risk assessment purpose and performing monitoring, CTDI volume and DRP is very good for parameter for risk assessment purpose, but effective dose also we need. So we need to determine whether to measure the radiation dose for every diagnostic radiological examination or only for relatively high dose examinations such as CT or PET scan. And third thing we must decide is that need to determine the level of the enforcement. And the second thing is direction of the diagnostic radiation control. As all you know, that personal dose tracking and procedure tracking is somebody eager to have personal dose tracking and somebody's procedure tracking. And actually, the result of our research, we are not yet decided the direction of the diagnostic radiation control, but it is somewhat risk for the personal dose tracking in Korea, so we are emphasize the procedure tracking or other practical implementation of justification. And third issue is medical radiation risk communication of the physician and patient. This is the ACR's white paper, and physicians should work with patient and effectively communicate with the potential radiation risk and has benefit of image procedures. And the Mosman said that the more information is conveyed, the higher the degree of public confidence. So this is a making need to understand the source and magnitude of risk uncertainties. So the conclusion, patients must be protected from unnecessary and unintended radiation exposure. And for patient protection, relevant stakeholders' understanding, communicating, and cooperation will be essentially needed. So the radiation dose control requires stakeholders' involvement and coordination. And first, government and national agencies are relevant to regulation development, enforcement, and scientific reports. And professional groups, including radiologists and radiation technicians, and medical physicists are developing guidelines, education, and training program. Individual hospital professionals adhere to procedure and protocol, and equipment vendors must develop dose reduction technology. This is a slide from our colleague Dr. Rao in his lecture, and this is a patient journey in the radiology department, and this is a total quality management map in medical imaging. And justification and optimization is very important portion of the total quality management in radiology department. And we all hospital professionals, including radiologists and other papers, are responsible for this kind of patient journey for improving health care. This is another examples for teamwork and using referral guidelines. The individual expert develop guidelines, and organizations and agencies needed to make a guideline, and authorities or facilities about adoption, and end users, that means the practitioners are responsible for application. So teamwork and leadership, culture, and participation is very important portion of our radiation control system. So I will move to summary of this presentation. The radiation exposure from diagnostic medical imaging has increased in Korea, and each stakeholders play a unique and complementary role for each patient-centered care system regarding radiological safety. Radiology and Nuclear Physician Society have a key role for radiation safety issues in Korea, including guidelines, accreditation, advocacy, scientific activity and education. And medical physicists and radiographers have an important role for quality management and optimization. And regulation is essential to control medical radiation exposure. Therefore, national organizations have made a significant effort to regulate and monitor medical radiation exposure using guidelines, accreditation, or even laws. Thank you for attention. 감사합니다.